Sawasdee krap. Good afternoon once again. Today is Monday, the 7th of June, 2021. So first, thank you to Dr. Thavisin for the Thai briefing just now. We also had Dr. Opat, the Director General of the Communicable Disease Control Department, giving a brief just now prior to me coming up on this podium. I'll just start off with the important issue first about vaccination and then following with the number of cases that we have for today. Firstly, as a general data, I'll just inform you first that from the 28th of February to the 6th of June, yesterday, we have already administered over 4.2 million doses of vaccines to people, including medical personnel, high-risk groups, as well as the general public. Now, Dr. Opat just now had mentioned about the visit of the Prime Minister to the Bang Su vaccination site, which is a major vaccination site for the general public, that this was this morning. Because as you know, we'll have images of this visit coming up for you to see. Now, as you know, of course, today is the commencement day, the first day of the national mass vaccination program. So starting today, this nationwide mass vaccination campaign has begun. We have some numbers for actually the first 2 or 3 hours of what's happening today in Thailand. In Thailand today, in the past 2 hours, up until, well, approximately around 10 a.m. until the cutoff time of 12 noon, just within the past hour, from 10 to 12 noon, this past 2 hours, there have been the opening up of 986 vaccination centers nationwide. And in the span of these 2 hours this morning, there have already been 143,000 people being vaccinated. So according to this pace, this efficiency of inoculating people, I think we're doing well in terms of following with our vaccination plan. So in the first 2 hours of the first day, we have 143,000 people already vaccinated. Now, for people over 60, there are 73,000 who have been vaccinated this morning. And for those with underlying diseases, chronic diseases, 21,000. These are the numbers only for this morning and only in the past 2 hours. Of course, one of the priority that we had known in the past weeks is that emergency use for medical personnel. Now, starting today, of course, also, particularly, the priority group will also be for the 60-year-old and above people, and those who suffer from certain diseases that are vulnerable to contracting COVID. So, as I mentioned, since in the span of 2 hours, I think it's a very good start, a very good pace. If we keep this pace up, we'll be able to achieve our goals. Now, for foreign nationals in particular, first, I just start off that you would know that the 7th of June today, as the first day, is National Vaccination Campaign. So mind you first that it's only the first day. But also remember that we've always been saying, and we're keeping to our word, that all foreign nationals on Thai soil are included in the National Vaccination Program. If you had been following the various news around Thailand, you would know that many provinces around Thailand have already begun their announcement in English in terms of mass vaccination for foreign nationals. These provinces include, but of course are not limited to, the provinces of Phuket, Chiang Mai, the island of Samui, and Hua Hin, for example. Now the authorities in these provinces have come out to do PR campaign for foreign nationals in the area to come to be vaccinated in the various centers that they have arranged. As we had mentioned earlier, if you had registered with the hospitals that you have medical records, many of those hospitals have already begun to accept the registration in the past weeks, and of course more will begin so today. if the hospitals do not have the registration system or facility yet for foreign nationals, please give them some time because this is the first day. But in the past days and weeks, and especially today onwards, many more hospitals will be implementing this scheme. And as you see in the major provinces, that has already been done. So hospitals with your medical records. Now, in addition, the Department of Disease Control has launched the website thailandintervac.com, and we'll have an image of that for you on screen, for foreign nationals, in addition to the registration platform set by each province. So the Health Ministry, the CDC, accepting registration for COVID vaccination through this website that you see on screen. Now, prior to this platform was for registration of foreign diplomats. Now they have transitioned to accept registration for those eligible in the initial phase, the first day, so to speak, which are those foreign nationals who are at least 60 years old or have the following underlying diseases: severe chronic respiratory disease, coronary artery disease, chronic kidney disease, stroke, cancer patients receiving chemotherapy, diabetes, and obesity. So individuals with these said diseases must present the personal identification, such as passport and evidence of illness, at the vaccination site. And the evidence can be a picture of the medical records containing information with specific diseases, or the prescriptions with your names, and this evidence should not be over 1 year old. And you're advised to register beginning today. Actually, this website will start today in the afternoon, so please allow time, perhaps around 3 or 4 p.m. You're advised to register 2 weeks in advance of your intended vaccination date, and the appointment date will can be requested online. Note that for this scheme, intervac.com, this website, no walk-in will be available. You have to register in this website first for all vaccination venues coming from this website. And other foreign nationals will be able to register in this website at a later period. That means that expats and the general public, further details will be announced in due course. Now, I'm talking only about Intervac, Thailand, intervac.com. As you know, as I mentioned just now, the hospitals that you have medical records, the various sites around the country in the provinces have already begun to accept foreign national registration. So as you can see, there is progress in sync with the national policy that we have begun today. I'll move on to the number of cases that we have recorded for today. New recoveries today exceeds the new confirmed cases for today. Very glad to hear, very happy to hear. We have 2,999 persons who have recorded to be recovered today, compared to the new confirmed case for today, which is 2,419, as you see on screen right now. Of this number, we have 1,347 cases from within the healthcare facilities, 949 from the active case findings, and just smaller numbers from the prisons, and smaller numbers from the international arrivals in quarantine. We have currently 49,101 people actively as active cases still being treated for COVID. We have recorded 33 new fatalities, making the cumulative 1,269. The number of new cases in Bangkok and nearby provinces remains constant, with around 2,000 to 3,000 cases daily. Each province would have a different nature of clusters. So for instance, Bangkok clusters still found in factories. Clusters in Nonthaburi are concentrated in the prisons and construction sites. In Pathum Thani province, for example, the existing clusters are detected in markets, while in Samut Prakan it is in factories. Now, another observation is that in the past few weeks, there have been several new imported cases from people who entered the kingdom through overland border checkpoints and natural crossings, entering illegally. The authorities have tightened border patrol to prevent any illegal crossing into the country that may cause new infections. So basically, you can see that today it is a very good day, very good beginning for foreign nationals who live in Thailand. There are quite a number of platforms and channels for you to register in the same time that Thai nationals are being registered, beginning the commencing. Now the appointment date, it will come either early or a little bit later. That doesn't matter as long as we have the registration information for you. This is, of course, in addition to the previous information that I had mentioned about informing the hospital that you have your own medical record and the other designated hospitals which have already opened up their registration system. Now, finally, I'd just like to say that for the sake of effective planning and to avoid overcrowding and crowded gatherings and long queues, I'm sure that many of you are concerned with that the first day of any event would be kind of overcrowded. So with this in mind, most of the venues and hospitals have made it available for people to make the vaccination appointments in advance. So most of it would be according to pre-registration for all the vaccination venues. Now for most of the hospitals, I believe most of the hospitals for today, walk-ins would not be accepted. It's the first day to officially register through the various platforms, and your appointment will come in due course. This actually is something that is also true for Thai nationals as well. So many facilities do not allow walk-in, have not allowed walk-in for today, but they have allowed the pre-registration. For example, in Bang Su Vaccination Center, which in the beginning of my briefing, I showed you some images of the Prime Minister visiting that place this morning. That's also one place where pre-registration is the norm for the general public. So that's the reason actually why we tend to not want to use the word walk-in for the National Vaccination Campaign scheme, and we have used the word online registration to begin on this day. Nevertheless, we have good news. According to the statistics that I informed you in the earlier part of my briefing, we have 986 vaccination centers. Within the span of 2 hours, we have almost 150,000 vaccinations. And of course, throughout today and the coming days, when all the appointments come in place, we will surely have a lot more, higher number of vaccination, and it will accelerate. The acceleration rate will get higher because we have, of course, more supply of vaccine coming in. We have this mass vaccination campaign. So with this pace, with the first 2 hours of today as a sample, I'm sure that if we keep on this pace, we'll be able to achieve our objectives in the days and in the weeks ahead. Mind you that in the month of June, the total number of people of doses to be administered would possibly reach 10 million by this very month of June. So hoping for the very best and hoping for all of your cooperation and understanding. I thank you very much for your attention and have a very great week ahead. สวัสดีครับ